Good morning, Professor Goldstone. I'm James. I'm one of the haematology trainees currently in Kent, and it's a real pleasure to meet you.
And you?
So I just want to start by just sort of understanding your experience in haematology and your role and where your interest lies.
I'm here, and I think we're doing this interview because I'm a previous president of the BSH in 2001. I have been a consultant haematologist since 1976, all the time in this institution, UCLH now, which used to be UCH. I came here as a senior registrar, as they used to be called, from Cambridge, where I trained under Frank Hayhoe, whom you may know, who was the kind of father figure of cytochemistry. That was in the era before surface markers were very prevalent, and we used to use that to attempt to diagnose all the leukemias. I was at UCLH continuously until 2011 as an NHS consultant. I continued to do some private and academic practice till 2015, and since then I've been working solely with HCA, who are a private organisation who have a joint venture with UCLH in haematological oncology, which has always been my interest. So I've been counting the board stuff. I've been 50 years in the NHS, and my specialisation at consultant level has always been haematological malignancy.
Yeah. And within the field of haematological malignancy, was there a particular bent to where your passion within it lay?
I'd known this place as an undergraduate, and when I came here, it had a kind of atmosphere of a place in decline. And the two most prominent specialties were cardiology, which was still kind of stethoscope cardiology and only. There's nothing wrong with the stethoscope. And poor attempts at cardiac surgery. It looked like it wasn't going anywhere. And the most eminent physician was a chap called Lord Rosenheim, who had been previously president of the College of Physicians, who was a hypertension and renal man. And he was getting towards the end of his career, and they hadn't put in transplantation or anything. And I thought, heck, if we don't do something in haematology, we're going to go the same way. So I persuaded the visionary head of department to let me go to the US to train in transplantation, even after already being appointed a consultant. And my main mentor was a guy called Dean Buckner, and he said, you can't go straight from here to go back to set up an allogeneic transplant program. What you should do is start with this autologous transplant, high-dose chemotherapy and stem cell rescue. So I came back here and did exactly that and set it up in a very difficult environment with no proper transplant ward. Two things happened. I took autotransplantation in lymphoma to the EBMT and set up a big registry in relation to that, which goes on till this day. And then we were invited with Alan Burnett to look at autograft in what were then called the MRC leukemia trials. And then the whole thing got going. And then a few years later, I recruited my colleague Steve McKinnon, who'd trained at Imperial and had gone to the Sloan Kettering in the US to come back and develop the allogeneic program. That began to make an impact.
Amazing story of how you got to where you are now. What was it that actually sparked your interest in haematology in the first place?
I think it's quite an interesting story. So when I qualified, I don't know whether it's the same now, but the main way to get on was to get a house job in your own teaching hospital. So I was the first one here that ever turned down an in-house house job and went out to do real work. First of all, as a medical houseman at Chase Farm in Enfield, which is not very far from here, and then as a surgical house job at Edgware General Hospital, which was a big general hospital, now a community hospital. Thinking what to do, I was really helped by my first boss at Chase Farm in Enfield, who was a general physician with an interest in GI and haematology who was trained in Edinburgh, and he fixed me up to go to the Western General in Edinburgh to train in, do an SHO in gastroenterology, which was fine, working towards. I knew I didn't want to be a surgeon, so I wanted to be some kind of physician.
Yeah.
Anyway, the job itself went quite well. And there was a guy sitting there, and he said, Tony, the specialty that's going to do the smartest science yet be the closest to the patient is going to be the big thing in the next few years is haematology. And we have a vacant job at registrar level in the haematology department at the Western General Hospital in Edinburgh. And then in 73, applied for this senior registrar job in Addenbrooke's in Cambridge. And then when I did come here, I was determined to try and set up a major leukemia service, and did the first auto transplant in the side room of the third floor of the old building.
These are sort of things that I think every young haematologist in training sort of aspires to. Is there anything particularly that you are most proud of?
I suppose the two things at the top of the list. One is to get a personal chair from UCL from an NHS consultant job. That is with no allocated academic sessions at all. Second was CBE in 2008, which came from the development of the service here from nothing, and it's going to be, when the new building opens, the biggest blood centre in Europe next year. I'm putting together the rationalisation of cancer services as the director of the North London Cancer Network, which rationalised the services between UCH and the Whittington and Royal Free and all those places. So I think probably those two things.
Oh, pretty amazing. So that's amazing. One of the things that I always wonder about with is different people's enthusiasms within haematology as well. But from an internal perspective, what is it that sort of gets you up in the morning?
The expression, which is often used as a cliche now, but when you do it well isn't, is going on the journey with the patient. The reason it's relevant to get it right in haematology is that your association, your close association with these patients and their families can go on a very long time. So it's rather important to get it right. There are few more fulfilling things than that.
It's really inspiring, and I think a really lovely way of seeing haematology as a specialty. Do you feel that there are any particular innovations? Obviously, I know you're going to move on to autograft and allograft, but within haematology generally as well, that have just completely changed almost within overnight the way that we work, or other things that have been more slowly changing it in a sort of profound way that you've seen?
Yeah, I think there are two different sets of things. One is how the service is delivered, and the other is the difference science is making and is going to make. Mm-hmm. If we deal with the first one first, which is relevant to the BSH and the College of Pathologists, we produce generations of very able individuals who are well trained in pathology and in clinical medicine and could deal with complex haematology. And many of them went out to district general hospitals and were almost overtrained, if you like, for what they had to do. And the standards of that training in this country, through the BSH and through the college, were such that the abilities of these individuals were impressive to any outsider from anywhere in the world. What I now see, which is a consequence of several different things, is a re-centralization of the very complex. who is going to want to train in your era and go out of the big major teaching hospitals when they haven't got the infrastructure to enable them to do the work at the level at which they're trained? So I think that's going to produce a major problem. So maybe people won't want to do it, or maybe they'll want to stay in the middle. So that's why they've got 43 here already, which is not down to me, and maybe. So I think it produces, and some of it's inevitable. I can see from my board level experience, and everybody else can see, that the health service is struggling, and some of the resource demanded in haematology per patient is higher than anything you could ever have imagined. So there are no easy answers. I think the further re-centralisation is inevitable, and we need to think through what are all the consequences of that. This business about, well, first of all, about immunotherapy is going to make an enormous difference. We're only in the very early stages, so we can't see what's really happening. But the conceptual switch over from battering the patient and their normal cells with chemotherapy and radiotherapy, and this idea that you really can harness the immune system in many patients to kind of do the job for the patient with fewer side effects, I think that's going to evolve over the next 10 years and change the whole face of the specialty. And on the red cell side, the changing and editing the genes in some of these hereditary disorders, which has already started with some degree of success, will again make an enormous difference. So you could reach a point in the next few years where there are radical changes in the kind of approach to the acute leukemias and the lymphomas and to myeloma, such that you bring some sort of immunotherapy. An allogeneic transplant is the crudest form of that.
What you've built over the last sort of 40, 50 years, it's incredible. There's a lot of trainees coming through, and they are, I think, sometimes very lost within the world of haematology. It's huge and it's very complex, and there's lots of, I think everyone has their own way of getting to where they want to be. But is there some advice that you could give me?
In this great morass of science and clinical care, you need a mentor or more than one. And so the problem with leaders, it's not in haematology, it's in everything. There are those that think if they leave nothing behind them, that is a tribute to how great they were, and then things gradually. So the true leaders have to have the generosity to give stuff away.
That's a really interesting account. I'm really honoured to have gone through your career and your thoughts on how things have developed and how things are going forward. And also, I'm going to take away quite a lot personally about how I want to shape myself and my career in haematology. So thank you. That was really good.